whenever we don't reach our goals, it normally has nothing to do with us setting the bar too high for ourselves, but rather that we didn't stick to our plan. And so if you don't make any changes, you can't expect to see any changes. So how does that philosophy of mind about change, how does that relate to your profession and what you do?
Yes, I love how you present that. Why has nothing changed? This principle can apply both on a small scale as far as day-to-day treatments and patients, encourage them to take preventive health care into their own hands with their lifestyle choices. This is important, just as important as anything we do in the treatment room, how they can make changes in their life at home as well. But even on a larger scale, our current healthcare crisis in America, just to point out some of the not-so-fun facts about our failing healthcare system, from the CDC here, doctors wrote more than 250 million prescriptions for antidepressants in 2010. Again, from the CDC, approximately 750,000 people were rushed to the emergency room in the United States just because of adverse reactions to pharmaceutical drugs. And then here we have the 11 largest pharmaceutical companies combined raking in approximately $85 trillion in profits in 2012. So this current debate in America about healthcare, I think, is invalid. I think instead of discussing who's going to pay and how much, what we should be looking at is what is true healthcare, what should it really be? Instead of severely misplacing time and energy and money and discussing, where the money's going to come from, who's going to be covered, is it going to be public, private, who cares? The bottom line is that the chronic disease is currently costing over $8 million a minute. We'll never be able to afford that. Why would we try to fund a healthcare system that is so severely flawed? That's continuing to put and purchase gasoline into a car with a broken engine. The current protocol is failing us. So this current protocol is beginning to treat the patient once they've already become sick and intervening with a drug or with a surgery that doesn't actually get them well. And so the only way out of this mess is to decrease the number of people who already are sick. And as I mentioned on our last show together, 80% of these healthcare challenges are due to lifestyle choices, these decisions and habits that we're making at home every day. So a paradigm shift needs to happen in how we view health, how we view healthcare. And to be truly healthy is not simply the absence of disease. If you're sitting right now listening to Chad and I on the show, the listeners, and maybe you're not feeling any pain or discomfort, or you don't have any systematic complaints or any symptoms, you can't even think of any reason to go see your doctor right now. And I'm sorry to break it to you, but that does not necessarily mean you are healthy. As the rule goes, if you're not growing, you're dying. If you're not getting better, you're getting worse. If you're not getting healthier, you're getting sicker. There's no staying the same. I'm sorry. You may feel very comfortable in your health right now as if you're coasting along or kind of drifting steadily, but unfortunately, I think that feeling is drifting. You're choosing sickness. So there it is. That's the challenge we're facing every day with your daily habits of food and drink choices, your exercise, your activity levels, rest and sleep, prayer and meditation, chiropractic adjustments. You're choosing sickness or you're choosing health. There's no real limbo here. And so this is not all doom and gloom. The change is happening right now, this paradigm shift in health. I get very excited when I see it in patients and friends and family, and I've seen it happen in you, Chad, and how you helped your clients and with your radio show. And what's really cool is when we begin to understand how a majority of these food products we're eating and consuming every day are unfortunately not providing us with proper nutrients. So we develop a whole foods diet, and we start to feel better when we eat better. And so it's easy to avoid these junk foods and then develop this keen body awareness, and we quickly feel how the choices we make with food and drink affect our mood and symptoms and energy and happiness. So we start to reflect on our activity levels, and we develop exercise habits that are healthier and make us feel much better. And we're simply choosing water to quench our thirst and avoiding soft drinks as if they're poisonous, because they are poisonous. And unfortunately, when painful or uncomfortable symptoms do arise in our lives, because that's not completely avoidable, we try conservative treatment options before moving on to more invasive things like medications and surgeries. And this is such a beautiful thing. It's a beautiful thing to experience. It's a beautiful thing to see in other people's lives, when they're seeking conservative treatment options. And this mindset, this practice is the heart of what true healthcare, I think, needs to be. Not only is this going to improve the quality of life of so many, but at the same time, it's going to drastically reduce that healthcare cost and take the strain off of that $8 million a minute cost of chronic disease. So that question that you ask and how you pose it, why has nothing changed? That's so great. It's because we need to change.
Yeah, I love your passion and your perspective on that.